Hey, good morning, everybody. Thanks for joining us for the Creative Staffing Agreements During a Pandemic webinar. We have Chief Mike Little with Violet Township and Chief Jeff Sharps with Truro Township with us today. So take it away.
Thank you. Good morning. We're glad to be here. This is Chief Mike Little from Violet Township Fire Department in Pickerington.
And I'm Jeff Sharps, Chief at Truro Township Fire Department in Reynoldsburg.
We are going to bring up our discussion stuff here today. If I can get it to work. There we go. And slideshow. So we want to give you an idea really quick of just where Violet Township and Truro Township are located. This map is a Google map that we put together. Violet Township is located in the northwest portion of Fairfield County. We cover about 42 square miles. We cover the cities of Pickerington, Canal Winchester, part of Reynoldsburg, Lithopolis, and we abut directly up against Truro Township.
Truro Township covers about 85% of the city of Reynoldsburg, Franklin County mainly. And then we also have the village of Bryce, and we have a community called Blacklick Estates that is also our coverage area. We're about 9.9 square miles, so geographically we're not real big.
Keep going.
We have Truro Township has 2 fire stations. We run 2 as a department. We run 2 engines and 2 medics with a battalion chief. In 2019, we made 7,563 runs. We average about 20 runs a day.
And over at Violet Township, like I said, we cover 42 square miles. Again, the cities we cover are listed there. We run out of 3 fire stations. We have an engine, a rescue, and 3 medics. One of our fire stations houses only a medic, and then we have a single battalion chief every day as well. In 2019, we completed 6,857 runs and probably running about 15 to 17 runs a day on average. Like everybody else this year, I'm sure that your run volumes may have gone down. We have seen a bit of a decrease downward this year because of the COVID issue, but overall, it's been pretty steady the last through 4 to 5 years for us. For our departments, because we're located so close, we have really chosen to try to work together on a number of things. And previous collaborative efforts prior to this staffing model that we're going to share with you revolve around our fireground procedures and our SOGs and the use of Blue Card. We have, over the past probably 5 years, come together and we have a singular fireground procedure that both departments use. Most of our SOGs mirror each other, and both of our departments utilize the Blue Card command system. Over the last 5 years as well, we have created a situation where we're able to utilize the Ohio Fire Academy, and twice a year in May and September, we go out and do fireground evolutions with all 3 of our units. And we also include West Licking Fire Department on that because all 3 of us generally work together and have automatic aid and provide mutual aid each other throughout the year. Run card development, again, we have looked at that as a collaborative effort, and we have created basically mirror images of our run cards that we utilize each other's departments as automatic aid for most of our runs. We both subscribe to RCOG EMS, which is a council of governments that has come together and offers the service of EMS. So we share a singular medical director and a singular EMS protocol, along with 16 other EMS aid and fire agencies throughout Central Ohio. And then lastly, we subscribe also to RCOG dispatching, and that is a group of 6 local departments here. The 2 of us, Plain Township in New Albany, Jefferson Township in Blacklick, Mifflin Township in Gahanna, and the city of Whitehall. And we share a single dispatch center for all of our run volumes. So, as you can see, we've already had collaborative efforts in the past, and it was just only natural that we would continue that going forward and looking at a staffing issue or a staffing protocol for this COVID pandemic.
So to give you guys a little background of kind of how we came together, and as Chief Little just described, the collaboration between Truro and Violet started well before he and I ever became chiefs. You know, the Ken Taylors and even the Jim Sharps and of the world, former fire chiefs, came together, and so Violet and Truro has a really good, robust history of collaboration, which made this, as Chief Little said, a little easier to navigate through. But both departments, we talked in early to mid-March when all of this stuff hit, and we thought we were going to have people dying in the streets, and we were worried about how we were going to man our fire stations if we had workforce reductions and those types of things. So we reached out to each other and said, you know, if this stuff really goes bad, like they're saying it will, how can we, as neighboring departments running automatic aid together, how can we kind of navigate through this? We had discussions, we brought in our assistant chiefs. We had some brainstorming sessions. We were using dry erase boards and really filling those up. And you know, the ultimate goal was just to continue to provide that high level of service to both of our communities, you know, in the event that we did have that workforce reduction. So we put together some documents that we're going to get ready to show you guys, and we put some concepts and theories together about what we wanted to do. And then once we did that, we brought in two of our senior battalion chiefs, one from Violet and one from Truro, and we sat down with them and challenged them to kind of, you know, give us reasons why we shouldn't do this, look at it from all angles. You know, could it really be a you know, a reality that we could do some of these things if we had to? So we developed, the first thing we did was we developed the staffing tracker, which is an Excel spreadsheet. And Chief Little's going to share that with you guys here.
Where am I?
I'm going to bring that back up, that screen you just had, I think.
Here we go.
Can we see that? Bring your share your Zoom screen back up, the camera, blue camera.
Where am I at?
Oh, right there.
Oh my gosh.
Yeah, bring that up.
Can we see this?
Can you guys see that? It says your sharing screen is paused.
No, it's a new share. There we go.
There we go.
There we go. Got it.
How's that? Can you see
Is that
that?
better?
There, yeah.
All right.
All right. So the first thing we did was we wanted to develop a way that we could, to the second, evaluate the staffing for both stations. You know, in the event that we had members that would come down with COVID, or if we had to quarantine people, we wanted to be able to kind of have our dashboard that we could track those individuals with dates and stations and those types of things. So as you can see up there, we have Violet staffing up there right now, and it's got the individual, the member, it's got their status if they're active or they're out, and then the expected return date. And if you scroll up a little bit, or go to the first page.
Go to the first page, yeah.
The first page then shows the total staffing, the total available staff, and then the total that's inactive right now. And that was kind of our dashboard that we would look at to evaluate the staffing for both stations. And it would be an indication at certain benchmarks when we would have to enact certain measures in the event that we did have a workforce reduction.
So the only thing I'll add to this is that this is a real-time sheet, and this is actually up to date as of today. As you can see, at Violet Township, we've got a little bit of an issue where we've got some staff members out. We're having, over the past week, we've already started to have an uptick in positive COVID cases with some of our personnel. Everybody on the list is not necessarily, that's inactive, is not necessarily a COVID case, but it's also potentially a long-term injury illness type issue that's keeping them out. So we're tracking those types of items along with the active code on this. So we have a pretty accurate description of what our staffing is between the departments. Let's see, let me go to, we're going to bring up our, when I figure it out, we're going to bring up our sheet that talks about our various levels here and how we, there you go. So this is our staffing model. This is what, when we sat and brainstormed and talked about all this, we came up with basically 5 levels of staffing that at each level, there's a little difference. At the top 2 levels, which we consider 3 and 4, those become very, very critical levels or crisis levels concerning what our staffing is going forward. So the way things sit right now, we are still operating what we call DEFCON 0 or level 0, excuse me, and we're maintaining our 3 platoon staff at both stations, and our intent is to maintain those as long as possible. And that is your just continued daily staffing. The next level up, level 1, is a level where we consider utilizing our 40-hour personnel to supplement our shift. And what that means is I have at Violet, I have a community paramedic, an EMS coordinator, and I have 2 fire safety inspectors. And the possibility exists that if we continue losing staff at Violet, then we would put those 4 individuals back into a shift position to supplement and still maintain that 3 platoon staffing. You know, those guys obviously have had experience on the trucks. It's not like they don't know what they're doing. Most of them, 3 of the 4 of them are lieutenants. So they could be on a truck and act as the company officer and take that spot and function as well and keep us moving forward with our 3 platoon staffing system. The next level is level, what we call DEFCON 2, and we consider this to be a critical staffing area. And we really looked at the staffing at this point between both stations as a total effort, as not separately, but combined together, and came up with a number of 16 being the number of people off between both departments. And that number can be made up of whatever it takes to make 16. It could be, 10 people at one department and 6 at the other. It could be 8 and 8, whatever that comes up to be 16 people off creates this critical staffing level. And what that prompts at that point is not only the use of 40-hour personnel in positions, but also then canceling all time off at both departments. And again, at this level, our intent was to keep a 3 platoon system to make it as normal as possible for as long as possible. We'll go down to, when we get into what we call DEFCON 3 or our level 3 staffing, this is what we considered crisis staffing. The definition we looked at again was 51 members, and we really discussed this a lot as to how many members could we be at, but still remain as a 3 platoon system at both departments. But the other part of this is to keep that 3 platoon staffing system at both departments, we would have to brown out some of our vehicles. We are starting the process now of saying we have enough personnel, but we don't have enough, we can't staff all the vehicles. So strategically speaking, what vehicles can we keep in service with our 51 members? And when we looked at this, we decided that for both jurisdictions, keeping an engine and 2 medics in service in both departments was probably the way to go, and then utilizing a single battalion chief. So for Violet Township, what this meant was that we would keep our medic 591, medic 592 in service. We would keep engine 591 in service, Because we also run a rescue, that rescue would be moved down to engine 5 or station 591 with the engine, and that could be cross-manned depending upon what the run need was. So if the run need was more for technical rescue purposes, that engine crew could cross over and take the rescue, and vice versa. And then Medic 593, which is our medic that sits by itself in a station, if we had manpower, we would keep it in service, but if not, it would be out of service for the period of time that we need it. And then at Truro Township, it meant that they would keep engine 161 and both of their medics, 161 and 162, in service. And then both jurisdictions would just share a singular battalion chief. We both have battalions on duty each day. Again, if we had to, we can push one of those battalions back to a company officer position to staff an engine if needed. So we would just adjust that on a daily basis. The other big part of this that you see in bold is that we both would have to be in contact with our surrounding departments to reconsider how our automatic aid is done. For Violet Township, we're more concerned with Fairfield County. We do runs with Columbus, but we don't get called by Columbus on the level that Truro does. So for us, we would be really talking with our Fairfield County partners and Madison County or Madison Township and Franklin County, and just really discussing, how we were going to adjust our automatic aid during this period of time, because we just would not be able to offer the same level of automatic aid to these departments that we currently do. I'll let Chief Sharps address Truro because there's a big difference with them and Columbus.
Yeah, I think that with regards to this, it would just be a matter of communication, just, letting our surrounding departments, as Chief Little said, just know exactly where we were at. And if we did brown out a station, obviously they would need to be made aware of that, so they could take them off their run cards and those types of things.
The other thing to remember for Truro and Violet Township, because we developed this plan collaboratively together between our two departments, it does not alter the status of automatic aid between Violet Township and Truro Township. No matter what happens in either of our townships and our response areas, Violet and Truro will remain in response to each other. We'll maintain that same level of automatic aid that we currently have today. So that was one of the things that we made sure that we did not change for ourselves. Our last level is what we consider DEFCON 4, and this is what we call catastrophic staffing. Again, we looked at what we needed to do, what was the minimal amount of people we could have between both departments overall, and go into a 2-platoon staffing model. And we came up with 36 between both departments. There's no question that we can't operate a 3-platoon staffing model at this level. If we're down to 36 members between both departments, we would have to go to a 2-platoon model. It would either be a 24 on, 24 off, or a 48 on, 48 off model. And we would make that decision based on, discussions between the chiefs and the assistant chiefs. We would again share one battalion chief. Everything you see in DEFCON level 3 up above it would be in play. We would be browning out stations or browning out vehicles as needed. We would staff whatever we could. And again, we would be in contact with all of our surrounding departments and discussing how automatic aid, mutual aid may change based on this. But for Truro and Violet ourselves, we would remain in response to each other as we are now for automatic aid. Looking at this, it was really difficult to try to decide and make these cutoffs. But after a lot of discussion, and as Chief Sharps alluded to, a lot of whiteboard planning, we came up with this and feel like it's probably the best model we could develop for both departments. Staffing levels every day, since we're reaching an issue where we're having some COVID issues and people off, we're looking at these staffing levels every day. So that Excel spreadsheet that we previously showed you is getting updated every day, first thing in the morning after roll calls, to make sure that it's reflecting exactly what's going on in both our departments. So we know when we start reaching these points with people off where we're at and what level we're operating at. currently we've been able to maintain our level 0 position right now, and that's where we currently are, and hopefully things will get better for us. But as we're all seeing right now with the increase in COVID positives and what's going on in the state of Ohio overall, our concern is that it's going to hit the fire departments and it's going to hit us pretty hard here in the coming months. So we're looking at that every single day. The other issue we have is that we had to get information out to everybody in the department, and the one way we could do this was we created what we call a sit rep, a daily sit rep. I'm sorry.
That's the last page.
Let me get to there we go, page 1. There we go. So we created a daily sit rep between both departments, and I'm gonna let you address that.
Yeah, so really the assistant chiefs took charge of this, and I think they did just a fantastic job of putting our sit reps together. When we started this was a every day we issued it was a 24-hour period for the sit rep, and then we went to a 72 to 96, and we've actually suspended it for at this point, but at this point we're probably going to sit down and reevaluate where we're at. But this was a joint effort between our assistant chiefs to get this out to the staff every day, or whatever that operational period where we were at.
Okay, there, just a second. We can still just see the spreadsheet.
Really? Okay, I'm sorry.
Yeah, that's okay.
Let me get a new share.
There you go.
There we go. I forgot. I'm sorry. I forgot to go to new share. My bad.
It's okay.
So I'll tell you what, really quickly then, let's, where's our, it's not there.
Mm-hmm.
All right. Can you see that sit rep now?
Yes.
Okay. I'm so sorry. Good.
So just like the other, I'm sure everybody, they were putting out sit reps. This actually was in this document that was put out to the department was in a PowerPoint. So it was easier for the battalion chiefs or the company officers during roll call to kind of go through the sit rep daily and just navigate through that with the information that was put out. In the beginning, we were just trying to, relay that message to treat every run like it could be COVID, which is what we're doing now. And then it would also provide them at what level we were at. And again, this sit rep was put out to both departments members, and it would show up to the second manning levels for both departments. PPE counts and supplies, PPE runs at the time. Again, this is going to be updated here within the next week or two. And then just kind of, it would give everybody kind of that operational awareness as far as fleet, as far as vehicles out of service or anything like that. And then it would kind of, we felt like it was important for our members to kind of have that awareness, at least in central Ohio, if not the state, as far as what the COVID situation was at the time. We felt it was good information. I think we all can probably have discussions maybe offline about how politics plays into things and maybe sometimes that affects people's judgment or thinking. So we thought it was important to just relay the information, the up-to-date current information. And what we wanted to put there was the counties that were affected. Obviously, Turo's and Franklin, Violet's and Fairfield, but we both, abut to Licking County, and we do a lot with West Licking Fire Department. So we picked those 3 counties to have that awareness of. And then we made the commitment between the 2 departments when we decided to do this, to really kind of adopt a daily routine in the event that you know, we did hit DEFCON 4, and if we went past DEFCON 4, we were at Broken Arrow, and we would have to potentially start talking about you know, some transfers of personnel to departments and those types of things. So we came up with the daily routine at the time, just trying to get individuals just, you know, kind of thinking and acting and working in the same mode.
Some other stuff we looked at was procedural changes, talking about our dispatching, and things we could do there, and our battalions, you know, not taking all the PPE runs at the time. If you recall, when this all first started, I think we were all concerned about what was happening, what was going to, you know, how the runs were going to look, and we were sending battalions on just about everything, and we've learned a lot since then that they don't have to do that, that we can make sure that our people are utilizing their PPE like they're supposed to, and that they don't need a battalion chief on every single run. As everybody across the state has noticed, you know, PPE initially was very difficult to come by, and people were just, you know, we were ordering stuff and trying to get as much as possible. I think that has settled down a little bit. But again, like everybody else, we tried to lay out some guidelines for PPE use and when to use full PPE. Looking at our protocol, what types of treatments should be avoided. You know, those kinds of things, and making those changes in our protocols. We talked about, you know, again, our transports and where we were going to transport people. I think initially this was really a difficult thing because it was so much up in the air as to what we were going to do and how it was going to be done, and how much PPE people had to have on, and did you have to go to a PPE room versus a standard room. And I think, you know, 8 months later into this, while there's still a lot of that going on, I think it's really settled out a lot, and our transports have really settled down. And even with COVID patients, while we may be going to a special area of the EDs, it's not as over the top as it was 8 months ago. You know, documentation, we continue to make sure and make notations in our run reports about COVID for tracking purposes. And then cleaning and decon. This was a really hot button issue, obviously, and I think it still is. But I think we've got a better grasp on it now, 8 months later. You know, some of the things we're doing at Violet Township is we do have an electrostatic sprayer that we utilize once a week in all of our medics in the patient compartment areas. We're cleaning more often, especially, you know, in the trucks, but also in the stations. Our guys are obviously far more aware of hand washing, wearing the face masks, utilizing hand sanitizers, all these things we've talked about. So I think we've done a really good job over the last few months getting that message out there, and we have noticed a big change in our people as to how they do stuff. The rest of this SIT report, or this SIT rep, really just kind of revolves around informational type things. We've got CDC links regarding, you know, quarantine type plans. We've had our infection control officers involved in this at both stations about what we have to do if personnel become exposed and how to deal with that. We have a return to duty plan that this actually needs to be updated because this was last in May. Some of this has changed, so we need to go through and update some of this and bring it back to what the CDC is currently recommending with the 10-day return and all that kind of stuff. But again, it's something that we kept in front of our personnel so that they knew what was going on, they knew what to expect, and they kind of knew how to deal with stuff. And then we have a number of attachments. These are all hyperlinked attachments that would take our personnel to different documents regarding each of those title items, just so they had more information at their fingertips to be able to answer some of their questions. And then lastly, any additional information we might see was our last page, anything if there was temporary assignments, you know, that kind of stuff. It was all listed here so everybody knew what was going on. So this was, you know, kind of the sit rep for us. Let me go back to our PowerPoint. All right. So, you know, as you can see, there was a lot that we really put into this. One of the questions that's come up to us recently was, you know, how did you justify, or how did you come to the capability that you think you can share staffing? Did you have to go through legal counsel, or did you run through legal counsel? And I would answer you and say, no, we didn't. We essentially looked at this, that if we reached a point where both departments were lacking staffing and we had to share staffing, we just basically looked at it as an automatic aid or mutual aid type thing, or as a move up. Here in Central Ohio, when there's a large incident within our dispatching area, if there's a number of vehicles that are out, we do move ups. So it's not uncommon for Truro Township to have an engine or a medic move into Mifflin Township for a period of time, or for Violet to move into Truro or Mifflin or another area at the request of the dispatch center, until such time that those other trucks get the other trucks are back in service. So we really kind of viewed this in the same light, that this is like a move up for us, or it's like an automatic or mutual aid issue for us. We're not necessarily cross-staffing our trucks with a Violet and a Truro person on a truck, but the situation might arise where one of my medics is sitting in station 162 for a 24 or 48 hour period. And we felt that that was, you know, more than okay based on those types of agreements. So that's kind of how we tackled that, and how we kind of got past the issue of running it through legal counsel. We've not really had anybody question it. So unless that comes up, I think we're going to kind of rest on our laurels on that and go forward.
Yeah, and I would also add that I think this is just, again, you know, we have the different levels of, you know, just trying to manage our organizations with some type of reduction in workforce. So, you know, at some point this would fit into the much bigger picture on a county level or a regional level. But this is just the you know, the first kind of steps that we thought that we could take between the two departments to just try to, you know, again, absorb any of these reductions in workforce. So it wasn't something that we thought we were going to do and put ourselves on an island and forget about everybody else. It was just something that we thought we could do collaboratively, really in an effort to continue to have both departments operational, and in the event needed, could help other departments navigate, you know, any reductions that they might find themselves in.
So our email contact is shown on the screen right now. We're happy to answer any questions anybody might have right now. If you would like to have any of the documents that we've shown you today, we'd be more than happy to share them with you. Just send one of us an email, and we'll make sure to get them to you. We're all about not reinventing the wheel, that if we have something we can share and it works for you, then we're more than happy to get it out to you and share it. But that's what we have for you today, unless you have any questions we can answer for you.
So far, I'm not seeing any questions. No, I think we are good to go.
Okay, well, we appreciate you having us. We appreciate you allowing us the opportunity to share our stuff. And like I said, if anybody would want any more information, just feel free to email us, and we'll be more than happy to get everything out to you that you'd like.
Here, I have one question. Do you know of any part-time departments using this?
Any part-time departments?
Yeah.
To our knowledge, I would tell you no. We both at both of our departments, we utilize part-time personnel, but as for surrounding departments that are part-time, I don't know that anybody is using any type of staffing model like this.
Okay. All right. I think that's all. Thanks for joining us today, everybody.
All right, thank you so much.